Okay, okay, fine.
Yeah.
Okay, ma'am. So there should be some notification from your end.
Yes,
That
I
go
will
for
tell.
go live. Go
Just,
live. Check.
just,
Sure.
just. Huh? Yes. Yes.
We are live now, ma'am, right?
Yeah. Yeah.
Okay, I'm starting.
Yeah.
A very good evening and a warm welcome to one and all present in this session. The expert in conversation with Dr. Ritu Sanpati. And this session is brought to you by Pluripotent. So for today's conversation, we have come up with a very exciting topic, role of stem cells in ovarian and testicular rejuvenation. As you all know, stem cell therapy has raised new hope in the field of reproductive disability management in recent years. And to share expert comment on this, we have Dr. Sajida Shahnaz Ahmed as an expert today with us. Let me take this opportunity to welcome ma'am. She has completed MBBS, MCPS, FCPS in Ops and Gynae. She has fellowship in clinical ART. Ma'am is teaching associate with Andrology Institute of America. She is also the CEO, director at Andrology Institute of Pakistan. Starts ICSI. Next, we have the organizer for today's session, Dr. Ritu Sanpati ma'am. She's very famous among all of us. She is obstetrician and gynecologist, cosmetologist, and IVF specialist. Currently, she is the director at Pune Test Tube Baby Center and Sham Wellness Clinic. So, ma'am, now the session is over to you for the next proceedings.
Yeah. Yeah. Thank you, Debulina. Thank you, ClientNet, for giving the platform. And friends, a very, very warm welcome to my dear friend, Dr. Sajida, all the way from the Pakistan. So knowledge is the power. So knowledge always increases by sharing. With this motto, I have organized the series, The Experts in the Conversation with Dr. Ritu. So this is a knowledge sharing global forum. In this program, on every Thursday, we are inviting one expert and discussing on one very important topic, and what are the practical situations are coming in our day-to-day practice, and what the dose and duration of the drugs we have to use. Today, Dr. Sajida is going to enlighten us with a very, very important topic regarding the role of stem cells in the testicular and ovarian rejuvenation. So because with this, the stem cells, there is a lot of dilemma in everyone's mind. Why not to use some drugs? Why not to use PRP? Why to use stem cells? And up to the what success, what percentage we are getting the success. So now first I'm handing over the mic to Dr. Devolina, Dr. Sajida. After that, after her talk will be over, we will take some question answers. So once again, a very, very warm welcome, Dr. Sajida. My dear friend, these lovely roses for you from here.
Oh, thank you so much. These are really lovely roses. I can feel the fragrance. Yeah, I can smell it. Okay, thank you so much.
We
Thank
all
you
are
so
waiting
much,
eager.
Dr. Ritu, for your lovely invitation. And it is matter of great pleasure and honor for me that I'm here among you all people who are bubbling with knowledge. And it's a matter of happiness for me that I am there among you. And today my topic of sharing is role of stem cells in testicular and ovarian failure. Lot of doctors were interested and they were asking me that, Dr. Sajida, that when you will give your presentation, when you will publish your research about this thing. And it is a matter of honor for me, and it's a great pleasure that I am going to announce that we have done our research, and it is inshallah that will be published in a month in a America journal. And then after publishing, I will share these results with you. And we have selected about more than 800 patients for this research. Okay, and
Very, very congratulations, Dr. Sajida.
thank you
Very,
so
very
much.
congratulations.
Thank you so much. And we have got about 52, around about 52% result of our success. That is a great number. And I will give you all the secret behind that, how this will work and how it is going to be improved with the HOTA registration, because we are actually, there is a problem in our Pakistan, that we have to register in HOTA, and HOTA is not allowing us. We are separating our stem cells. We cannot culture it. because
Okay.
HOTA registration is required for that, and that process is on the way. And after inshallah registration, we can inshallah start induced pluripotent stem cells for the best results for our patients.
Great, great.
Okay.
Dr. Sajida, this HOTA is some advisory board in the Pakistan?
Yeah,
Or-
this is human organ transplant authorization.
Okay.
Yeah, okay. So
Okay.
this is the system. Actually, we have to register in that, and we are on the way of registration, but it will take time because otherwise we cannot start the induced pluripotent stem cells.
Okay. Okay.
Anyhow.
Yeah.
Okay, should we start? Should I start?
Yes. We all are eagerly waiting to hear you.
Okay, thank you. Where is that? Yes.
Yes, we are.
Okay. I have to go back.
Yes.
Can you see? I think so. It's more.
No, we are able to see.
Okay, fine.
Yeah.
Yeah, actually, when I did it, I went so far. Yeah, actually, I was studying for myself. Is that moving? I have to start from the beginning. Okay.
Okay, no issues. You can.
It's not going back. I know.
Otherwise, you stop sharing and again start sharing.
No. I stopped sharing and then I don't know what's the problem. Yeah. I can't go on on the previous. What is wrong with that?
Debulina, can you help?
Yeah, just a minute because.
Oh.
No, I want to go for the previous slide. No, this is not first one. Previous.
Ma'am, there should be some option laptop, right arrow, left arrow, upper arrow. You can click the left arrow and it will come to the back slide from the laptop key button. Left arrow.
Yeah.
Yes, just click on that. You will be in the first slide.
This is the last one. I don't know. Yeah.
Or ma'am, you can just stop the sharing and come to the first slide. Then you can.
Yeah,
yes,
this is slide. But
and you can click the resume slideshow. Resume slideshow. There is option.
Okay.
Small box.
This one. It's
no,
not going to click. Yeah.
Not that one, ma'am. On that yellow bar, there is a little box, resume slideshow. I can see, ma'am.
Yeah.
You need to click on
this
that.
One, yes. You are screen
You are in the last slide, ma'am. Is there any? Yes. You need to. You can scroll down to the first slide. I mean, scroll up to the first slide.
Okay. Yeah.
Yes, please click on the first slide and then the same process from beginning, slideshow. First time you did, ma'am.
I can't do that.
Click slideshow now from beginning. Left option, ma'am. Your left option.
Start slideshow. Yeah, this one?
No, not that, ma'am. From beginning. Okay. Yes, that one. Yes.
Okay, fine. Yeah, fine. Thank you. Okay, this is my brief introduction about my qualification, and that's all. And then we will, I think so, there is lost of wastage of time. Okay, now we can go. Anyhow, have you seen Dr. Ritu? That I have shown you specially, there is a piece of land that is infertile land. Yeah. And opposite to that piece of land, that is absolutely fertile land.
Fertile land.
I think, will you agree on this thing that once the land that was infertile, after many, many years, that lands may convert into absolutely fertile land. Can anyone tell that what is the process that infertile land is automatically converted into fertile land? So what are the processes which are involved in these things? If we think, is that responsibility of that water? Is that these minerals or environment? Whenever we will think, we can say there are a lot of postulations, lot of theories, lot of statements about these things, that some people will say, okay, when there are the land is infertile and that automatically water sewerage is going to change, so that process inside the land is going to change, and that land is automatically converted to fertile land. Still yet we cannot say on these things. So exactly when we do these things, we think about, another example is that I will explain in the relevance of stem cells. Okay, whenever we think that we have 5 common human senses, have you ever think that if one sense is deficient in a human being, what happens to the other senses? Have you ever met to a person who is blind? Okay, have you ever noted that blind persons are overcompensated by these other 4 senses? Yeah, because this is law of nature. Exactly what is the role of stem cells in our body? That is that whenever one organ is failed, it is law of nature that after failure, these messages are sent to the adjacent organs, and these organs start to produce more pluripotent stem cells, more multipotent stem cells, adult stem cells, which can help these organs. This is the basic theme that has brought towards this thing, that these stem cells from the adjacent tissues, which are basically multipotent stem cells, these can help these unipotent stem cells, which are basically present in that organ, and they can change the environment, and they can change the infertile land and hostile land of that organ towards the fertile land. Sorry. I think so, yeah. So I have made this slide especially for you, just to make it understand that whenever there is organ failure, when we think about the organ failure, do we think, is that anatomical failure? Is that physiological failure? If that is anatomical failure, whether unipotent stem cells are there, scientists have seen that they say, yes, even there is anatomical failure, but in spite of all that, these unipotent stem cells, which are specified towards that organ, these are even present in that failing organ. And when we say that physiological failure, then obviously unipotent stem cells are there. Then next question comes, that whether these unipotent stem cells are dormant or dead. Dead cells, these are very rare. If these cells are dormant, then these can be signaled back to activation mode. This is very important question. How we do the activation mode of these dormant unipotent stem cells of that specified organ. So this is the basic presentation, that how we can do the activation of these unipotent stem cells. These are already present in the testes or in the ovaries. By this will we do by the stem cells of the adjacent tissues of the same human beings, which are being prepared in abundant due to law of nature. Because this is law of nature, whenever there is organ failure. Because actually, Dr. Ritu, I will bring your attention toward that is very important point. Yes, next. That when COVID was going on, what we did, we actually selected some COVID patients and we tried to draw their stem cells from their blood. The patients who were actively sick, they have a lot of stem cells in their blood. And the patients who were not sick and they were only COVID positive and they were healthy, they were not having that stem cells in their blood. So this is law of nature, that nature always helps those by creating these stem cells who are basically sufferer of that disease. So these stem cells cannot be found in those human beings who are absolutely normal. So these stem cells can be detected in those human beings who are actually having some failure, organ failure, whether it is testicular failure, whether it is liver failure, whether it is any other organ failure. Okay. So what is role of stem cell in testicular and ovarian failure? This is our topic. And this was, I'm just going to show, Dr. Ritu, can you see my slides? Is there some, everything is going fine? Yes?
Yes. Fine,
yeah,
fine.
Okay. Okay, I am going to show my IVF lab and stem cell lab. This is our stem cell lab. And this person who is standing beside me, he is actually our stem cell researcher. And he has published many papers on rats for these role of stem cells in rats. Okay. And then, yeah, this is our team and we are standing in our stem cell lab. Okay, so this is the thing I have already shown you. So whenever we talk about the stem cells, the first question which comes in our mind, and that is, what is stem cell? Stem cell, everyone knows, I think so for the doctors, it's not a new thing, but for the doctors who are not working into that specialty, I would like to describe very briefly that these stem cells are totally undifferentiated stem cells, which can be differentiated into any form. Whatever the environment we give, that can be transformed into that environment. So this is the basic definition of stem cells. Okay, so when we think about a stem cell, it is basically a cell having a nucleus and cytoplasm. And then when we talk about that, what they do, actually, what the work they are doing, actually, stem cells are doing two types of work. One is self-renewal and another is differentiation. Because in our body, we have to compensate our loss by self-renewal of stem cells. In our organs, we have a lot of stem cells, and every stem cell is actually keeping multiplying, and it is going to copy itself, and that system of copying is called the self-renewal. And another system of stem cell, another property of stem cell is that they can differentiate or they can specialize into any cell. Okay, just like our MBBS student who are fresh graduates, and I think so these stem cells are our fresh graduates. They are bubbling with knowledge. So whatever specialization they are doing, they can become the master of that field. So that is the basic philosophy behind. So this is this is continuation of the same slide. I have tried to show you. Anyhow, whenever we talk about what are types of stem cells, basically there are 3 types of stem cells. Everyone knows, but I think so I have to make it clear. That should be a clear concept, that what is the basis of these stem cells. Number 1 is embryonic stem cells. Okay, what are these embryonic stem cells? When we talk about these embryonic stem cells, then we can see from where we can take these embryonic stem cells. These embryonic stem cells are taken from the embryos inner cell mass. You know that even every blastocyst is containing its outer layer and one is inner layer. Inner layer is composed of inner cell mass, and this inner cell mass is having the potential to become a pluripotent stem cell. Pluripotent means that type of stem cell that can be adopted into any form of the body, any form of cell. Okay, they actually, when we divide the stem cells, we divide on the basis of potency. So whatever cell that is highly potent, that is pluripotent stem cell. So these embryonic stem cells, these are basically pluripotent stem cells. And these pluripotent stem cells, these can be taken from embryo, number 1. Number 2, they are actually pluripotent stem cells. Number 3, they can adopt the shape of any type of stem cell. But the problem, Dr. Ritu, as you know, mashallah, you are actually IVF specialist in this field, because we are actually having a lot of embryos in our labs, and we can form these embryonic stem cells very easily. But the legal problem is that we cannot stop the replication of these stem cells. True. Actually, problem is that our whole hospital, whole lab will be filled by these stem cells. So this is the problem, that we cannot stop the activation of these stem cells. So this is the problem. This is the main theme which is restricting many scientists to do work on these stem cells. And if we get these stem cells and we select some stem cells of these embryonic stem cells, and we are going to inject these stem cells in testes or ovaries. So what is the risk? CA, malignancy is the risk. So that's the reason we are not doing work on embryonic stem cells, but still people are doing a lot of work, and they are thinking that this is unethical. But with the passage of time, inshallah, when people will overcome, when our scientists will overcome about these replication technology, and they will hold this replication, then we can start this work on our patients. So when we talk about the another type is tissue stem cells. Okay, when we talk about these tissue stem cells, then so first type was embryonic, another type is adult stem cells or tissue stem cells. Okay, first, I think so I have made my efforts to make it clear for everyone. If you have some questions, we will address it. And another type is tissue stem cells. This is adult stem cells. These can be derived from basically 3 tissues. Number 1, from the bone marrow. Number 2, from the fat. And number 3, from blood. As Dr. Ritu, I have already described that in the blood, we cannot find these stem cells unless that patient is under the experience of that active disease at that time. If he or she is suffering at that active disease, that is, he is or she is in the process of that organ failure, then we can collect these cells easily from the blood. Otherwise, we can't. So usually we take these stem cells from the bone marrow or from the fat cells. So these stem cells are, I have already told you that embryonic stem cells are pluripotent stem cells. It means that they can adopt the shape of any tissue, any type of tissue. And what is the difference between pluripotent stem cells and these adult stem cells? These adult stem cells are basically multipotent stem cells. So what is the difference between multipotent and pluripotent? Multipotent are those type of stem cells which can differentiate into many stem cells, not in any kind of stem cells. Okay, these can differentiate into many stem cells. So what is this many? We will talk about this. Another type, third type of stem cell is induced pluripotent stem cell. This is most important thing, and this is the most thing which is going on in research, because scientists have made this type of pluripotent stem cell that these are ethical because these can be derived from the same individual. If I am the person that I need these stem cells and for my other organ, then these stem cells can be taken from my fat or my marrow. But these cells need reprogramming. How we do reprogramming of these stem cells? So this is very, very, sorry, I have to go back. How can I'm sorry, I'm going forward.
Okay.
Yeah.
No problem. No problem.
Dr. Ritu.
No problem. Presentation is very interesting.
Can you help me?
Debulina?
Ma'am, the left option, you are clicking the right.
Yeah.
You have clicked the right click, I mean right arrow. You need to click the left arrow, ma'am. Or you can click right click previous slide. Yeah,
previous.
You're using Mac device, Dr. Sajida?
Yeah, actually I'm going previous for
I guess ma'am, she is having some network issue.
Yeah. Yeah, she's,
Yeah. What happened?
You're not able to see your slides. I think you have to share again.
Yeah. Can you see?
No.
No. Okay, let me ask. I don't know. I think so there is some internet problem.
Seems like
actually,
that.
Yeah, actually net problem. Mansoor को बुलाइए जरा. I'm sorry for this botheration. I don't know what happened. Actually, yeah, because I wanted to show something. मंसूर ये थोड़ा नेट का इशू आया है एकदम से, और ये चीजें जरा देखो जरा, क्योंकि वो मुझे देख नहीं पा रहे हैं. हमारा नेट तो नहीं ऑफ हुआ. अब कहाँ कैसे करें इसको? कैसे करो जरा. नेट का ऐसा क्या मसला हुआ है?
It happens sometime.
Yeah. Okay. अच्छा, इसकी प्रीवियस स्लाइड पे जाना है मैंने.
No, but still we are not able to see your slides.
Yeah, slides नहीं नजर आ रही. जरा स्लाइड शो हाँ देखो हाँ एक्चुअली नेट का अब हो गया मसला स्लाइड शेयर हाँ जी अब आ रही है
हाँ जी हाँ हाँ आप देख सकते हैं हाँ
ओके मंसूर ये आप बहुत आगे चली गई है आई डोंट नो व्हाई या मैं पहुंच गई
yeah I think this is the
okay.
correct
Yeah I think so we were on that slide so we I think so we were on that we were discussing about the induced pluripotent stem cells
yeah
actually
correct
okay so what is that induced pluripotent stem cell? These stem cells are derived from the same human being, but these are actually reprogrammed in the lab. How we actually reprogram? Actually, whatever we do, that we select the cell and then we inject a specified gene in that cell. Okay, and that gene can be taken, that can be derived from that human being, or that gene can be derived from a virus. Okay, and this gene can induce the differentiation of these pluripotent stem cells into that specialized form of stem cells. So this is actually genetic reprogramming. This is needed actually for our patients who are having testicular failure or ovarian failure. But we are doing actually in our lab as a research purposes, but this is not still yet approved by HOTA. So this is the problem, that we are on the way to approve all these things from the HOTA, that is Human Organ Transplant Association, that is in Pakistan. I don't know what is that called in your India. Anyhow, we are on the way to do that. And actually my doctors, when I presented my slide in their forum, and they asked me, is that induced pluripotent stem cell same as this is cloning? So I have specially formed this slide just to make them understand that this cloning entirely different from this induced pluripotent stem cell. So whatever we do in the cloning, there are two types of cloning. One is reproductive cloning. We are more concerned about the reproductive cloning. And one is that biological cloning. We are not in that phase, because this is field of research scientists. So we should know about the basis of reproductive cloning, so that our doctors should not mix these induced pluripotent stem cell with that cloning, because there were a lot of doctors, they said, no, Dr. Sajida, this is reproductive cloning, you are doing this thing in that. So I would like to describe this thing, that this cloning is, what is this cloning? Actually, we take a cell from a human body, okay, whatever human being we select, we take any mesenchymal cell, any DNA diploid number of cell we take, and what we do, we remove the nucleus from that cell, okay, and that nucleus, which is in diploid number, you know that whenever there is fertilization, we have haploid numbers. There are two types of haploid. One is from the male haploid number, one is the female haploid number, and then when these pronuclei, they build and they form an embryo with a diploid number. So what we are doing, that we are taking that nucleus from the body, which is actually diploid number, and we select the egg of that human person's wife, okay, and remove the nucleus of that egg, because we are already introducing that diploid nucleus inside the hollow shell of that egg. So the resulting embryo will be exactly 46 chromosome. So that is entirely different. When you will think about that induced pluripotent stem cell, whatever we do, we are not doing any removal of nucleus, not removal of any genetic material. Genetic material is same, only we are incorporating a specialized fragment of that gene inside of that cell just to make it replicate. Okay, so to make it differentiate. So this is the difference among these two things. I think so that our doctors might got understand. Yeah, inshallah.
No,
Hope
you
for the
make it
best.
very
Anyhow,
clear. Yeah.
yeah, this is molecular cloning, and this molecular cloning is actually at the research basis. You should know that, but we reproductive science is not entirely associated with these molecular clonings. Okay, so now we have come to that thing that we have separated our mesenchymal stem cells. We have ignited these mesenchymal stem cells by a specialized medias which are available in our lab. And after ignition, these mesenchymal stem cells with the same diploid number. This is very important. Okay, with the same diploid number, with the some medias which will assist. This is very important point. If this will be, I will make you understand, then you will exactly know that how these stem cells are going to help for these patients. You know that suppose we are discussing about a testicular failure, that's a man who is having failed testes. So what we have seen that he is still having germ cell. What are these germ cells? These germ cells are actually unipotent stem cells which are present inside that organ. First of all, we see that whether these are present or not. If these are present, we are going to put these mesenchymal stem cells with that igniting media, because this media is equally mandatory. Otherwise, these mesenchymal stem cells are useless. They are dummy useless. Otherwise, they will not ignite these unipotent stem cells, and the process of spermatogenesis will never start. So this is the method which we are going to adopt this, and we adopt this in our lab. And when these stem cells are ignited in that specialized culture media, we transfer these stem cells inside the testicular tissue. And after 3 months, because you know, as everyone knows, that sperm cycle is about 90 days. So after 90 days, we do another biopsy and semen analysis. There will be two options. Number one option will be there that after 90 days, if that person is so lucky, but this is only in 5 to 10% of cases, that the spermatogenesis will start, that organ failure will be recovered, and that will be repaired, that cell line damage will be repaired, and then these stem cells will work on the repair ground, and then new spermatogenesis cycle will start, and these sperms can be visualized in semen of that specified patient. This has happened in 5 to 10% of our patients. And these 5 to 10% of patients can even conceive automatically by spontaneous method, by natural methods. And what is the other option? That is about 52%. That is another option, that whatever we have injected in that atmosphere, okay, then these injected sperm cells will specially target that unipotent stem cells individually, and they will differentiate, they will change their unipotent stem cells into spermatids, and that specialized spermatids will be changed into a specialized adult sperm. And these sperms can be collected by a needle biopsy or by some other method, whatever is micro TZ, whatever. We have all the facilities in our center, and that is tailor-made approach, and we can do this according to patient choice or according to circumstances of that patient. And then these, if we find these sperms, then these sperms can be stored, that can be freezed in our lab, and with the help of these frozen sperms, IVF can be done. Because you know, Dr. Ritu, in our Pakistan, being a religious persons, we cannot perform donor sperm or donor egg. So whatever we have, we only have this option. So when patient will have few sperms, we used to congratulate them. We say that, oh, that's a good thing. Now you are candidate for becoming parent. Okay, so this is the good thing. Anyhow, I have tried to send you share some slide, my presentation. Actually, my research paper is on the way. So whatever I can show you that result, that we have selected 843 patients, okay, who were transplanted stem cells with growth medium and with that specialized medium. And before transplantation, these persons, they were azoospermic, and after 3 months of transplantation, these 550 patients have recovered. Hello, can you hear me, please?
Yes.
Yeah. Actually, this is the early, because we have published our paper, I think so, about 1,200 patients, and about 1,200, this is about 52 to 53% result. So this is the overall result we have achieved from this.
Great.
Okay, so Dr. Ritu, it is my open invitation for all of you that whenever you visit Pakistan, please do visit my lab. And if you are having some patients who are not opting this sperm donation or ovum donation, you can send them to our lab. And I have even given the option to my all colleagues who are living in Pakistan that they can come with that patient, and they can physically present at that time when we do biopsy. They will collect that biopsy, and they will see that biopsy on directly by their self. Okay, they can go to our lab and they can visit, they can see that whether it is having that sperms or not. So it is making our things very clear and very delighting things. Lot of physicians, they are coming, and after 3 months, they are bringing that patient. They are doing biopsy with their own hands. My few colleagues who are urologists, they have done this in our lab, and they are so happy and excited with getting these results. And this is the only hope for our patients.
Great. So a very nice presentation. Dr. Sajida, please stop sharing.
Yeah, okay.
Yeah. So you will come on the full screen.
Okay, fine.
Yeah. So a very nice presentation. I have one or two questions with you.
Yes.
Have you tried in these patients the PRP therapy before going to the stem cell therapy?
No, actually not. Sorry,
Okay.
I never went through, because I was aware of that therapy, but in 2015, in the early 2015, we started this method, and actually Dr. Zavos made, you know him, Dr.
Yes, I know.
Because actually I asked him, because I told him that, you know, Dr. Zavos, in India, there are a lot of other options. We are not having any another options apart from biological parity. So he came first in Pakistan, and our first stem cell baby of this world, whole world, that was being born in Pakistan in 2017.
Okay, okay,
Yeah.
great, 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 great. No, I have seen you a lot of pictures with Professor Javas. Professor Javas only inaugurated my center in India.
Yeah, I know. He knows you very well.
Yeah.
He might be joining us. Yeah.
Great, great. Acha, other thing, in these patients, prior to giving this, starting the stem cell therapy, any some criteria you select that for which patients you are going, any some blood test you want to do. These are the some queries I'm getting.
Yes. This is very, very important. Yeah, I should have mentioned already, but this is very important question, because first of all, we have to see, first of all, we ask that special patient for a Doppler scan. Okay.
Yeah.
We have to see that on Doppler, is their blood flow is equally on both sides? Is that a testicular tissue is having the possibility of having these germ cells on biopsy? Okay, so first of all, we have a Doppler. If blood flow is there, if there is a tissue with fibrosis is there, but not the whole tissue is fibrosed. Apart from that, if whole tissue is fibrosed, then there is no fun of having these stem cells. Okay, if there is healthy tissue inside, according to Doppler ultrasound, then we perform this. And other thing is that we ask for blood test, FSH, LH, and serum testosterone. If FSH and LH is already low, so first of all, we try medication, because it is hypogonadotrophic hypogonadism. So there is role of medication. If these are normal or raised, then this tissue is basically failed tissue. So we select those patients, only those patients where FSH, LH is already raised, that these are confirmed testicular failure or ovarian failure, and where that Doppler blood flow is normal. It is not absolutely restricted. Sometimes you have reversal of that blood flow, but sometimes you have total sclerosed areas in that tissue. So there is no fun that we are just going to waste our patient's money and time on that patient. So these are the mandatory tests. And one thing very important, I would like to mention here before your next question, because if the person, we have a post-operative follow-up of these patients. I forgot to mention, actually the patient, they come after 1 month, they give us some semen analysis, and we look at the semen that whether there are some abnormal cells, abnormal malignant cells inside the semen. If there is possibility of some, I have never seen a single patient with these mesenchymal stem cell with that specialized media. There is a single patient noted among these, among our studies, that no one shown that he is getting the risk of that malignancy. Although the people say and research says that there is 1% malignancy risk in these patients. So if we have already described this risk with that patient in a written form of consent, and then we do these tests. And if that is the possibility, then there may be possibility of removal of that testes or ovaries.
Okay. Yeah. Thank you.
And another, sorry, that is very important thing. Yeah, if that person is having, the person whom we gave stem cells and whom are candidates who have taken the therapy of stem cell, so if they are having high testosterone, so what do you suggest? That is that high testosterone that will hinder the result? What is your opinion?
See, I am so basically not in the stem cells, very frankly, I'm telling you.
But this is very important that
Yeah.
testosterone level, if that is raised by some medication, we have to bring it at the lower level. Otherwise, these unipotent stem cell will not work. Okay? So we have to do that. There are a lot of medications which are having side effects of these lowering the testosterone. So we have to use that just to get the effects of that stem cells. So this is also very important thing.
Okay. So which drugs you are using? Another question has come. You have just asked.
Yeah. Actually, I have brought that Prolistem from USA.
Okay.
Do you know about Prolistem?
Yes, I've heard about that.
Yeah. Actually, we are used to give that Prolistem in those patients who are having high testosterone level.
Okay. Actually, I'm basically doing the PRP therapy. I'm not into the stem cells, so that's why I'm very much interested.
So what is your experience regarding PRP?
We are getting very good results with the PRP.
Nice.
Yeah, but not in all the patients. Of course, the guarded prognosis we have to explain, as you told. So I'm using up to the PRP. I'm not into the stem cell.
Okay, nice.
Yeah. So as you explained now regarding this, your experience with the stem cells in the azoospermic, have you tried in some patients of low AMH also for this stem cell therapy?
Yeah. Actually, we did it. Actually, I went more into the testicular stem cells. For the patients, I went through, but the problem is that in our Pakistan, there are very few ladies who are coming for this. Actually, we have a lot of male patients who are taking this therapy. Actually, perhaps the problem is that they are independent. They are the commanding hands. So they are offering themselves for their treatment. And it is very easy in Pakistan to get a second marriage rather than to spend the money on a wife who is having very low serum AMH. Yeah, actually we are doing, and I will talk when I will complete my studies on this, that test ovarian failure. Actually, our number of patients are low, so we have to complete our studies on the targeted areas, that we have to complete at least 500 patients before giving our results.
Yeah, correct. Yes, this is a practical scenario, what you have told. Yes, very true.
Yeah, it's very easy to have a second wife with only celebrating a function, okay, with a little bit jewelry, which can be artificial, okay, and nothing else needed for that woman. So stem cell is very expensive.
Yeah. Other thing, post-stem cell therapy, are you advising any antibiotics or any specific nutraceuticals?
Yeah, I think so. We can. Sometimes we give prophylactic antibiotics for just 5 days. That if there is chance of infection, in Pakistan and India, we are facing a lot of contamination. Yeah. We are used to give, but nutraceuticals, I think so. Nutraceutical is not beneficial at that time, but in some patients we can give.
Okay. Sometimes the placebo also works. Yeah, that's correct. Yeah.
Yeah, of course.
Yeah.
Sometimes only placebo works.
Yes.
You know that.
Yeah. So thank you very much. Debolina, are there any questions? If you are able to see, please put here in the chat box.
Sure, ma'am, but till now we don't have any other query.
Okay.
The queries, yes, no, ma'am. We don't have any other query today.
Okay. So, Dr. Sajida, as this show's name is the Icons in Conversation with Dr. Ritu. So now we have covered the academic portion. Now I'm going to discuss with you some non-academic things. Okay.
Okay. Fine. I'm ready. I'm ready.
So this will be a kind of a rapid fire round, and you have to answer without thinking much. So this is a non-academic some questions. So what thing do you love most about your profession? Are you able to hear me? Yeah.
Yeah.
Shall I repeat? What do you love most about your profession?
Oh, yes. I would love to see my patient happy, whatever the problem is. Yeah, actually, that our religious performance, that is Hajj, Umrah, when I went there first time, that I was having my kids around, my husband around. And you know what I thought at the first glimpse of that holy place? And that I thought, oh my God, please help me regarding my patients. Yeah, I would love to help them at any cost, cost. Their smile is my life. Whenever they come with a smile and they say, oh doctor, yes, I'm getting this thing. And especially I think so that uh, especially for those who are infertile or those who are not having kids. So their smile is my whole problem, you can say in brief.
Great. Huh? So now my other question, your favorite color?
Yeah, red.
Red. Okay.
Red is better.
Okay. So
red is actually my soul color,
Okay, great. So
yeah. I have two. Sorry. I have two birthdays. One birthday at 14 Feb, that is my soul birthday.
Okay.
And one birthday at 14 August. Yeah.
Other is when?
Other is when 14th of August. Okay. So that is my body birthday. My body was delivered at that time, and my soul was delivered at 14th Feb.
Okay, great. Yeah. So you are a tea person or coffee person? Tea lover or coffee?
Yeah, tea. I would love tea. Mixed tea. Masala tea. Adrak tea.
Okay.
Yeah, typical tea person.
Okay.
Yeah, I like coffee too, but I am typically tea person.
Okay. And what about your favorite fruit?
Yeah, whatever is my favorite fruit, I can't eat too much. That is mango.
Okay.
That is my favorite, but I have to restrict myself. Otherwise, I will become mango too. Yeah.
Other thing, do you have any hidden talents? So please share with us also.
Yes. Alhamdulillah, I am having every type of talent. Whatever you want to see.
Okay, great.
So this is according to atmosphere. Whatever the environment, I am according to that. Okay. If that environment is Desi type or religious type, I am the most religious person. Okay. If that is of dance party and that I am of that person. If that is singing environment, I am a singing person too.
Wow, great. Good to know you, Dr. Sajida.
Yeah. Actually, I shared a post that I have started a poetry just recently.
Yes.
Yeah. A month ago, I have started my poetry too. So
marvelous.
This is fun.
Marvelous. So other thing, is it your dream to become a doctor since from the childhood?
Yes, this was my dream.
Okay.
Yeah, I have, because this, that my best friend was my real aunt, my khala, the younger sister of my mother. She was my best friend. Actually, she was not having child since long time. And I was a little kid when she was advised for IVF. And she was not affording IVF at that time. And whatever I said when she started crying that I cannot afford that expensive treatment, I went to her, I just hugged her, and I said that, oh Khala, don't worry, I will do your IVF. And she said, oh my dear lovely child, I will be not there in this world when you will become IVF physician. So this was my dream.
Okay,
Absolutely my dream.
great, 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 great. So thank you, Dr. Sajida, once again for your sharing your immense knowledge with all of us. And thank
Thank you so
you.
much.
Yeah.
That was lovely time. Thank you so much. Okay.
Most
Bye.
welcome. So before we wind up, friends, there is one I want to share with regarding on the 20th February, we are having the academic marathon. The focus of that is from infertility to fertility only on the CliveNet platform. So all of you are invited to join that session. Debulina, don't stop. Huh? I'm just sharing the screen.
Sure, ma'am, sure.
Yeah. So all of you are invited for this academic program. I have invited around 13 stalwarts all across the geography. So all are going to discuss on the very interesting topics. And this is a very good chance to have an interaction with the stalwarts. I am showing a small video for that. So all of you are invited. We have already displayed the joining link in all the social media. Hello everyone, season greetings. Are you all excited to continue our learning journey? I am here, Dr. Ritu Sanfani this side, founder and CEO of 360 Degree Healthcare Studio. Post 3 super successful academic marathons of 2021, I am organizing again on 20th February 2022, 1 p.m. Sunday, the another session of the academic marathon. The focus of this time is from infertility to fertility. For this, I have invited the 13 stalwarts all across the geography. So do register, dear friends. I have already shared the link. And cherry on the cake, the registration is free and open for all. But do register fast as the seats are limited. This is a unique opportunity to interact and learn from the stalwarts. So I'm happy to onboard you again on 20th February 2022, Sunday, 1 p.m. Standard Time. I will wait for all of you, dear friends. Do join on Sunday. Namaste. Cheers. So, dear friends, do join on Sunday. We will wait for all of you. With this, we will wind up for the today. So, thank you, Debulina, and thank you, whole CliveNet team, for providing the platform. And friends, for this my weekly series, next week we are meeting on the Wednesday instead of the Thursday, on Wednesday 23rd February at 8 p.m. with a very, very important topic discussion, the pre-treatment evaluation for the treatment of the fibroids. So do join us on 23rd February at 8 p.m. too. Till then, bye-bye.
Thank you, ma'am. Bye. Good night.
Bye. Good night.